Hello everyone. So in the last video we treated sickle cell disease or sickle cell anemia. So in today's video we'll be treating another topic known as microfilaria. So basically, looking at the overview of this microfilaria, so microfilaria they are basically known as immature larval forms of parasitic worms known as filarial nematodes. So these worms, they are transmitted to humans by the bites of infected insects such as mosquito or black fly. So once these worms are inside the human body, they grow into the adult forms, and they produce thousands of these microfilaria or microfilariae, however it's pronounced. And this microfilariae, it circulates in the blood or in the skin, and it causes diseases. So filarial infection caused by microfilariae, they have different types. For example, lymphatic filariasis, which is also known as elephantiasis. Then we have onchocerciasis, which is known as river blindness. Then we also have loiasis. Yes, that is African eyeworm. Then we have mansonelliasis. So basically, all these filarial infections, they are all neglected tropical diseases affecting millions of people in Africa, millions of people in Asia, Latin America, and they are often more common in poor or rural communities. So looking at the background of this infection, so these filarial infections, they have been known for centuries, but they remain widespread in places with poor sanitation, poor hygiene, and with places with limited access to healthcare. So this disease is spread through insect vectors like mosquitoes and black flies, like I said, and even deer flies. So depending on the specific worm involved, so there are 8 species of filarial worms known to infect humans, but we have 3 most common worms that are associated with serious diseases or serious infections, like for example Wuchereria branchofti and Brugia species. They cause lymphatic filariasis. Then we have, for the second one, we have Onchocerca volvulus, which causes river blindness. Then we have Loa, which causes eyeworm and calabar swelling. So the adult forms of these worms, they live in human tissues where they mate and where they reproduce and form this microfilaria, which then migrate into the bloodstream or the skin, making them easily accessible to new insect vectors during another bite. So looking at the signs and symptoms, so microfilaria infections, they vary in their presentation based on the species involved, because there are different species and there are different infections. But looking at the general signs, we'll break it down into like the different filarial infections. So when we're looking at lymphatic filariasis, there can be signs like chronic swelling of the limbs known as lymph edema, then genital swelling too, swelling of the vulva in women, swelling of the breast, then presence of recurrent fevers, and skin thickening and hardening, which is known as elephantiasis. Then painful lymph nodes will be present too. So when we're now looking at onchocerciasis, which is river blindness, there will be presence of severe itching, um thickened or leathery skin, skin depigmentation, that is leopard skin appearance. Then depigmentation, basically loss of the pigmentation of the skin. So there will also be nodules under the skin. Then progressive blindness due to the microfilaria migrating to the eye. So that's why it's part of the name, river blindness. Then for loiasis, that is caused by loa, it will see symptoms like localized swelling, which is known as calabar swelling, then itching and joint pain. Then sometimes the adult worm can even be visibly crawling across the eye. This is very distinct symptom of this loa. Then for the infection known as manzonelliasis, this is another filaria infection, is often asymptomatic. This particular infection is often asymptomatic. So it may cause, in rare cases, it may cause skin rashes, joint pain, and eosinophilia, but it's majorly asymptomatic. So looking at the clinical presentation, patients may present with night fevers, especially in cases of infection with lymphatic filariasis. That is the one that is caused by Wuchereria branchofti. So there will be night fevers, visible swelling of the limbs or the genitals, chronic itching or skin changes, then eye symptoms like redness, visual disturbances for river blindness, worms crossing the conjunctiva for lower, and nodules under the skin, which can be seen for onchocerciasis. Then systemic symptoms like fatigue, loss of appetite, weight loss can also be present too. Then some patients, they may carry the parasite without obvious symptoms for years. Just needs a particular trigger. So when we're looking at the etiology or the cause of this condition, so most of the time microfilaria infections are caused by the microfilariae, the immature forms of these parasitic worms, like I said earlier. So they are caused by Wuchereria branchofti, they are caused by Brugia species, Onchocerca volvulus, loa, and Manzonella pestans. So these are the major worms that cause these infections. So these worms, they are transmitted through the bite of infected insects, such as Culex mosquito, Anopheles mosquito, that is for Wuchereria and Brugia, that cause lymphatic filariasis. So they are majorly transmitted through the infection of these mosquitoes. Then black flies particularly cause river blindness, so they cause onchocerca. And then for loa is caused by deer flies, by the bites of deer flies. So these are, they are transmitted by the bite of these flies. So for the risk factors, like I said earlier, living in a place with poor sanitation or poor water management, poor hygiene, then living in endemic tropical or subtropical areas, and places that have poor access to insect protection, like poor access to mosquito nets or mosquito repellents. Then when most people that perform outdoor occupations like farming, fishing, they are more at risk of getting these filaria infections, because they are majorly outdoors. So also having long-term exposure to mosquitoes or flies is also another risk factor. Then traveling to places, traveling to or from endemic areas too. Then looking at the anatomy and the physiology. So basically, adult filarial worms, they live in specific body sites. Like for example, lymphatics, we have, that's where you find Wuchereria and Brugger species. Then subcutaneous tissues and nodules, onchocerca. Then for connective tissues under the skin and the eyes, this where you find lower. So microfilariae released by adults, they enter the bloodstream or skin, and they migrate to other tissues, and then they await injection by insect vector, another insect bite. So the human host is basically the definitive host, where the adult worms, they come, they live and reproduce, while the mosquitoes or the flies serve as the intermediate host, where the larva develops. So the humans are the definitive host. They house the adult forms of these worms. These were the adult forms of these worms. They live, they reproduce, they produce the microfilariae, and then in the mosquitoes, they serve as intermediate hosts where the larva develops. So for the pathophysiology, first, the insect bites an infected person and ingests microfilariae. So basically, when the insect bites this infected person, it means that this microfilariae has entered the bloodstream already and entered the surrounding tissues. So the insect bites the infected person, ingests the microfilariae. The microfilariae mature into infective larvae inside the insect as their intermediate host, and then inside the insect, they grow and mature for like over 10 to 14 days. Then the insect will now bite another human, injecting the larva through the skin. So it will take, okay, this is a mature larva, and it will take this mature infective larva, inject it into another person. Then this larva will migrate to specific body tissues like the lymph nodes, the subcutaneous tissue, and then over months the larva will now mature into adult worms. Then these adult worms, they will produce thousands of microfilariae that will migrate to the blood and the skin, and the cycle continues. So this cycle reminds me of how malaria is actually spread. It has similar characteristics to how malaria is spread. So the immune system reacts when this microfilariae migrate to blood or to the blood or the skin. So the immune system reacts to the worms and it reacts to the larva, causing signs like inflammation, blockage of the lymphatic vessels, skin and eye damage, chronic swelling and disfigurement. So basically, all the signs and symptoms we see for these different filarial infections is the immune system reacting to the presence of these worms in the body. So it's like it's kind of like a defense mechanism. So that's what causes all these symptoms that we see for the different infections. So looking at the diagnosis, so for the diagnosis, we can use microscopy. Number one, we can use Gemsa stained blood smear to detect microfilariae for Wuchereria and Brugger species. So usually the sample is collected at night, which is known as nocturnal periodicity. Then we can also do something called a skin snip biopsy. So it's used in cases of river blindness, that is onchocerciasis, to detect skin dwelling microfilariae, that is the ones that have migrated to the skin. Then eye examination, so in terms of lower, where we see the worms moving on the conjunctiva. So it's usually done for visible lower worms when it can be seen with the naked eye. Then serological tests too, like antigen and antibody tests. PCR to confirm the particular species that is causing the infection. Then ultrasound may show movement of adult worms in the lymphatics. Then also doing a complete blood count may reveal eosinophilia. So this is also a good diagnostic approach. Then when we're looking at the differential diagnosis, other infections that could mirror these microfilaria infections, we have number one, lymphoma, or other cancers that cause swelling of the lymph nodes. Then tuberculosis, then leprosy too, due to skin lesions and nerve involvement. And dermatitis could mirror the same rashes that can be seen in onchocerciasis. So these are basically the other infections that could mirror the same symptoms as this microfilaria infection. So for the approach consideration on the management, so we have to use antiparasitic medications like diethylcarbamazine citrate, which is particularly used in lymphatic filariasis and lowiasis. So we use it for infections that are caused by Wuchereria bancrofti, that are caused by Brugger species, and they are caused by lowa. Then we also use ivermectin. So ivermectin is particularly used for river blindness and for mass drug administration. Then albendazole too is often used and is used in combination. So when we are trying to manage the complications, like for example, for lymph edema now, we have to elevate the legs. Then we have to do avoid trauma to the particular lymph node that is swelling. Then there's also something that can be done for in cases of genital swelling. This is known as hydrocele surgery. So in cases where the genital swelling is very severe, this surgery is usually a very recommended option. Then for skin management, for in terms of when this microfilaria has attached itself to the skin, so we can use moisturizers, antifungals, antibiotics. Then for eye care, then for the eye care, when it comes to severe complications for eye care, we need to do urgent referrals, especially in cases with river blindness, because river blindness is very known to cause complete blindness if not handled properly. So in endemic countries, they usually do something called mass drug administration programs, and it's usually conducted to interrupt the transmission of these infections. So it usually involves a combination of ivermectin, albendazole, and or diethylcarbamazine. So we call this mass drug administration program. Then vector control, that is using of mosquito nets, mosquito repellents, mosquito insecticides, and environmental sanitation too. Sanitation of just doing regular environmental sanitation, trying to reduce poor sanitation, like checking the water management, the drainage. So this can really go a long way to curb these infections. So looking at the prognosis, so for this particular infection, with early diagnosis and proper treatment, microfilaria infections, they can be controlled or they can even be eliminated. So it just depends on the patient. So if you treat yourself well and you're able to diagnose this infection early, there's a high chance of complete cure. And prevention of complications in terms of elephantiasis or blindness, it depends on timely therapy, like catching the infection early and starting the therapy early. Then chronic conditions such as lymphedema and skin damage, they may not be easily reversible. And in endemic areas, they usually use mass treatments, that is with the combination of ivermectin, albendazole, or diethyl carbamazine, and vector control. And these are usually crucial to break the transmission cycle. So in endemic areas, these are usually implemented to reduce the transmission of these infections. So that's basically the breakdown of these microfilaria infections, which are infections from the immature forms of parasitic worms known as lower Wuchereria branchofti. So that's basically it. Thank you.